Hello, welcome to Becoming Your Healthiest Self, Session 2. We're going to focus on how metabolic syndrome evolves into disease and what to do about it. So we want to have a very holistic approach to our healthcare. The Center for Disease Control has a website. Picture is from that website. And it has some rather alarming statistics that 6 in 10 of us have some sort of a chronic disease that's related to lifestyle. And 4 in 10 have 2 chronic diseases. Also from the website, they list these 7 as the most common chronic disease states that Americans are experiencing. And they list these as the key lifestyle risk factors. Dietary risk factors are considered the #1 risk factor, and that physical inactivity, low physical activity is farther down the list. Foods on our right, they're going to cause problems in our body, and there's the snack items that we might choose versus the antioxidant, more of the whole food snack items. So metabolic syndrome, that only 12% of American adults are considered metabolically healthy. Metabolic syndrome is a group of risk factors associated with modern medical problems of chronic disease. Fat around our waistline or in our belly it's around our important organs. Blood pressure, that's rising, that's a sign. If the LDL cholesterol is over 100 or triglycerides over 150, fasting blood glucose over 100 milligrams per deciliter, or the A1C above 5.7. A test that's not done very frequently, but elevated fasting insulin levels, you have to request that from your doctor because it tends to be a more expensive test. Kind of a cute comic, the doctor's saying, high sodium, high cholesterol, lots of toxins. Your blood test is remarkably similar to a potato chip. According to this study from the New England Journal of Medicine, it showed that Americans gain about a pound a year, but it was potato chips that were the most strongly associated food to weight gain, 1.69 pound increase over the 4-year period. French fries being a close second. So it's the oils all around these potatoes. And of course, once they're potato chips, they're processed food, but the oil is the main ingredient that makes them fattening. In 1 soda a day, so someone might think, oh, I'm only having 1 soda a day. That's moderation, Actually, that contributed a pound over the 4 years. And an alcoholic drink, almost half a pound. Those who exercise regularly gain 2 pounds over the 4 years instead of the 3.3 for non-exercisers. Sad diet, our standard American diet, is causing this excess in our system that the system just can't deal with. So just exercise more or just take medications and surgeries, probably not enough, right? Metabolic syndrome actually occurs over a period of several years, but it starts with the diet. So pretty soon we're having to have increased insulin levels to deal with this influx of things we're eating all the time. And then with the increased insulin, the body starts packing away the fat. And pretty soon our blood pressure and cholesterol begins to rise. And then finally, the last thing that shows up is the increase in our blood sugar levels when the cells are just so stuffed full that our body can't keep putting in more sugar. So it starts showing up in our bloodstream. Of course, the solution is to deal with the root causes, primarily our diet. So with our processed food industry, these highly addictive foods, we're compelled to overeat them. This is what a cross-section of a human being should look like. White areas represent fat. So you can tell, he has some, but when it's at an abnormal level, it looks more like this, where the white areas, fatty areas, are dominating the abdominal cavity and beginning to press into important organs. So this is showing that there is hope. People are very capable of reversing this process. So primarily the diet. So we can see that after 35 weeks, this cross-section here looks more like the athlete. And even in a few weeks, we can see significant changes. So what about the heart and heart disease, the number one killer of Americans? So this is showing before and after picture of somebody that changed their diet, and you can see that there's much less fat around the heart. This video is going to show how atherosclerosis develops, and it's talking about the vessels around the heart, but this happens in our vessels all over our bodies.
Atherosclerosis is a slow, progressive disease process that commonly affects the coronary arteries. Atherosclerotic lesions begin with an endothelial injury due to chronic hemodynamic stress in circulating oxidized LDL cholesterol. The resulting endothelial cell dysfunction facilitates monocyte and lymphocyte migration and allows LDL particles to pass into the intima where they become oxidized. Oxidized LDL is phagocytized by infiltrating macrophages, resulting in lipid-laden foam cells that accumulate in the intima and form fatty streaks, the earliest visible lesion of atherosclerosis. As the disease progresses, growth factors released by surrounding cells promote migration and proliferation of vascular smooth muscle cells into the intima. The infiltrating smooth muscle cells secrete collagen and proteoglycans that form a fibrofatty plaque, also known as a mature atheroma. Continued accumulation of cholesterol within foam cells promotes cellular dysfunction and necrosis that produces a core of necrotic lipid debris surrounded by a fibrous cap of varying thickness and cellularity. As the lipid core expands, impingement upon the arterial lumen can cause a reduction in myocardial blood flow, resulting in myocardial ischemia that can manifest as angina pectoris. Plaques with a thin or weakened fibrous cap can rupture and release thrombogenic collagen into the bloodstream. This results in rapid thrombus formation, prolonged ischemia, and subsequent necrosis of the myocardium, also known as myocardial infarction.
So can plaque buildup in the arteries be reversed? Yes, they can. This angiogram of a cardiac vessel actually shows the vessel belonging to a physician, a vascular surgeon that works for the Cleveland Clinic. He had chest pain, and so he had a scan done. This is the way his vessels look. His colleagues told him that we can't do a stent on that vessel. It's just too diverted for stents to be effective. So he had known about plant-based diets, and so he did plant-based diet for 32 weeks, and his chest pain went away. He seemed to feel normal again. Took another scan, and you could see and looks closer to normal. Let's talk about the liver and liver disease. So this is looking under a microscope at the normal liver tissues on the left, and once we have fatty liver disease on the right. So this is when the fat gets backed up into the liver, and the liver has no other choice but to store the fat. And it doesn't want to store it there. So if we change our diet, the liver will start to get rid of that fat. So this non-alcoholic fatty liver disease related to our diet is detectable in the majority of middle-aged adults. So younger adults is 35%, but middle-aged adults, it's 56.4% have signs of this fatty liver disease. So if you have a bulging waistline, chances are you do have some degree of fatty liver disease. For older folks, it's 57.3%. So this is showing that progression of fatty liver disease is definitely reversible through diet, especially the diet and lifestyle changes. So what happens to all these excess sugars and proteins and fats, processed food? The liver basically turns everything into fats to store it other areas of the body. It tends to spit out these triglycerides and these low density lipoproteins, or the very low density lipoproteins are thought to be primary drivers of vascular disease. But as far as what's causing the greatest amount of fatty liver, it's the alcohol or the sugars. Even children are getting fatty liver disease from all the sugar that's in the diet. And specifically fructose. Sugar is made out of glucose and fructose, half and half. Fructose is metabolized just like alcohol is. So either alcohol or sugar can result in this fatty liver disease. And of course, the solution is to not drink the alcohol or not have so much sugar to reverse the problem. So we get these frequent blood spikes in sugar, fat spikes, too much protein. It's getting circulated through our system. So pretty soon we get this slow decline of health, gradual increase of health problems. So the solution is kind of obvious here at this point, right? We want stable blood sugars. We want to have, moderate levels of fat and proteins going through our body, not excesses. And then we generally see a slow return to vibrant health and fewer health problems arising. But we're going to look at this video here by Dr. Michael Greger. He's addressing this issue of caloric density and this idea of calories, all calories being equal.
Well, let's explore that example of carrots versus Coca-Cola. It's true that in a tightly controlled laboratory setting, 240 calories of carrots would have the same effect on calorie balance than the 240 calories in a bottle of Coke. But this comparison falls flat on its face out in the real world. You could chug those liquid candy calories in less than a minute, but eating 240 calories of carrots would take you more than 2.5 hours of sustained constant chewing. Not only would your jaw get sore, but 240 calories of carrots is like 5 cups. You might not even be able to fit them all in. Our stomach is only so big. Once we fill it up, stretch receptors in our stomach wall tell us when we've had enough. But different foods have different amounts of calories per stomachful. Right? Some foods have more calories per cup, per pound, per mouthful than others. This is the concept of calorie density. The number of calories in a given amount of food. 3 pounds is about what the average American eats in a day. As you can see, for example, oil is a high calorie density, meaning a high calorie concentration. Lots of calories kind of packed into a small space. So drizzling just a tablespoon of oil onto a dish adds over 100 calories. For those same calories, you could have instead eaten about 2 cups of blackberries, for example, a food with a low calorie density. So these 2 meals have the same number of calories. You could swig down that spoonful of oil, not even feel anything in your stomach, but then eating a couple cups of berries could start to fill you up. That's why, yes, biochemically, a calorie is a calorie, but eating the same amount of calories in different foods can have different effects. The average human stomach can expand to fit about 4 cups of food. So a single stomach full of strawberry ice cream, for example, could max out our caloric intake for the entire day. For those same 2,000 calories, to get those same 2,000 calories from strawberries themselves, you'd have to eat 44 cups of berries. Right? That's 11 stomachfuls. As delicious as berries are, I don't know if I could fill my stomach to bursting 11 times a day, right? So some foods are just impossible to overeat. They're so low in calorie density, right? You just physically couldn't eat enough to even maintain your weight. In a lab, a calorie is a calorie, but in life, far from it. Traditional weight loss diets focus on decreasing portion size, but these eat less approaches can leave people feeling hungry, unsatisfied. A more effective approach may be to shift the emphasis from restriction to positive eat more messaging of increasing intake of healthy, low-calorie density foods. But you don't know until you put it to the test. Very nice. Researchers in Hawaii tried putting people on more of a traditional Hawaiian diet with all the plant foods they could eat. Unlimited quantities of fruits, vegetables, whole grains, beans, and the study subjects lost an average of 17 pounds in just 21 days. Calorie intake dropped by 40%, but not because they were eating less food. They lost 17 pounds in 3 weeks eating more food, in excess of 4 pounds a day. How could that be? Because whole plant foods tend to be so calorically dilute, right? You can stuff yourself without getting the same kind of weight gain. They lost 17 pounds in 3 weeks eating more food.
Foods here on the bottom are the foods that are going to really contribute to our weight gain so much more easily, right, than these foods on the top. And so the more calorically dense foods, you just have to be aware of, what they are. But as far as nuts and seeds, that the fiber will protect us from some of those calories. Of course, we can eat all we want of these foods. How should health problems be addressed? This is from the Baha'i writings. Do not neglect medical treatment when it is necessary, but leave it off when the health has been restored. Treat disease through diet by preference. Abstain from drugs when health is good, but administer them when necessary. And that's a quote from Baha'u'llah. Will humanity become healthier in the future? So again, from the Baha'i writings, at whatever time highly skilled physicians shall have developed the healing of illnesses by the means of food, and shall make provision for simple foods, and shall prohibit mankind from living as slaves to their lustful appetites, it is certain that the incidence of chronic and diversified illness will abate, and the general health of all mankind will be much improved. This is destined to happen. Moderation in consumption of processed foods. I'm reminded of that just one serving of potato chips a day, resulting in, over 1.5 pounds of weight gain, in the 4-year period. And one soda, resulted in 1 pound of weight gain over that 4-year period. And is moderation good enough to reverse metabolic syndrome? 88% of people do have signs of metabolic syndrome. I really don't think it's possible to use moderation as far as the processed foods to reverse metabolic syndrome. Keep track so we know if we can get our belt to fasten a little tighter, or if our blood pressure goes down, cholesterol goes down, blood sugar levels go down. We can keep track of these things, and we can watch our weight on the scale. But this quote says that when an illness is slight, a small remedy will suffice to heal it. But when the slight illness becomes a terrible disease, then a very strong remedy must be used. So I think once we have these syndromes and these chronic disease, lifestyle-related processes, and it's kind of beyond where a small intervention is going to work. So we would want to keep track of all of these factors for our overall health and wellness. Thanks a lot. I'll see you next time.